this talk. It's a real pleasure to be asked to give this talk. I will just start off by saying that I'm not a clinician myself, and I don't work directly in addiction, but as you'll see, my work addresses issues to do with addiction, and I am now beginning to do research in the area. So as an overview, I'm going to tell you, just briefly look at stereotypical attitudes about addiction. And what is addiction? Well, it's actually about pleasure. And what is pleasure? Now, addiction is the loss of control over these pleasurable activities, and I'll explain what I mean by that. That will allow me to talk a tiny bit about brain networks and addiction, which will then go into what the talk is actually about, which is addiction following different types of brain injury. And that will be both in adults and with children. I'll briefly talk about therapies because I know that that is an important issue. Can we help people with these difficulties? And then I'm going to end with a twist in the tail, which is rather interesting. So I always like to start with what the layperson in the street thinks about addiction. So this would be a classic example of what people think. Someone who's unfortunately been shooting up in a doorway, out for the count, etc. So that's a very visceral, classical image of what addiction is. But would we have counted this as addiction? So two parents on their phones, eating, not talking to their child, but staring at their phones. We're beginning to understand more and more that there are behavioral addictions, such as internet use, etc. Would this be classed as an addiction? The need to spend a lot of money, maybe on things that you don't really need. So there's another behavioral addiction, shopping. So it's important to realize that addiction is not just about drug use. It is about pleasurable activities that may eventually end up with someone not being able to control themselves very well. So what is happening in this world? What is addiction? So this is a definition that I took from the NHS website, which is that addiction is defined as not having control over doing, taking, or using something to the point where it could be harmful to you. Now, from that, I'm highlighting the relevant bits, which are not having control over something, overdoing something, etc., and where it could be harmful to yourself. So addiction itself isn't the issue, it's the control and the harmful nature. So it's not the substance, whether it's smoking, drinking, the drugs, etc. It's the loss of control and the potential harm. Now, to understand why this may come about, it's important to understand what's happening in the brain. Now, this rather simplistic diagram of the brain helps us understand something about this. Now, very simplistically speaking, we effectively have three brains in one. We've got what's known as the reptilian brain in the yellowy color, which is the most primitive part of the brain, and it's just for our instincts and urges, which helps us stay alive. Then in red, we've got what's called the emotional limbic brain, which gives us pleasure, motivates us, etc. Then finally, in that bluey color on the outside, the walnutty bit on the outside, that's known as the decision-making or neocortex. Now, all animals have all three of these. The thing is that in humans, the decision-making part, the neocortex, is particularly developed. Now, so knowing this will help us understand why addiction might come about. And to help us, I'm going to start off with the prefrontal cortex, which is the outside bit, so the bit that's most advanced in us. And we get an amazing amount of information and insight into brain functions from a very bizarre accident that happened in the 1800s in America, where a railroad company was laying down tracks for a new railway line, and they had to have timed explosions to allow them to lay down the tracks. And what happened is that an explosion went off when it shouldn't have done, and a supervisor called Phineas Gage, who was standing nearby, unfortunately was in the way. An iron bar about an inch thick flew up from where the dynamite was, went through his lower left cheek and exited from the middle of his head. The iron bar was going so fast that when it exited from the middle of his head and it flew a further 20 feet in the air, that's how fast this iron bar was going. So effectively, he'd been speared by an iron bar and the iron bar exited from his head. Surprisingly, he didn't die from this. Now, he survived, and initially it seemed that nothing had changed. The man could remember, he could see things, he could speak, etc., etc. But very quickly, it turned out that things had changed. A man who'd been very reliable, church-going, financially astute, etc., supervisor in his company, became extremely unreliable, wasn't able to make decisions, lost all of his money, lost his job, became socially uncouth. And this is a photograph of that man called Phineas Gage from the 1800s, because he became a kind of circus act going around with this iron pole. Now, 150 odd years later, a patient was seen in the United States and Iowa by Paul Eslinger and Antonio Damasio, neurologists and neurosurgeons. And this patient had a huge tumor growing in the front of his brain, which would have killed him, excuse me, which would have killed him if it hadn't been treated. They tried all the drugs they could, and unfortunately, excuse me, unfortunately, they weren't able to reduce the tumor. So the only option left was surgery. So surgically, they had to come from the top of the skull, remove the top of the skull, then come down and remove the tumor from the front of his brain. Now, remarkably, what happened is that this man's problems ended up being very similar to Phineas Gage's 150 years previously. He had been a financial controller for his company. He was married, they had a good family life, etc. Within 2 years of the surgery, he'd become divorced, married again a month later, divorced again 2 years later. He was incapable of making a decision. He lost his job, became bankrupt, and there's a description of him taking 5 hours to decide where to go for dinner. When this image was created, it was created to try to work out which part of the Phineas Gage's brain 150 years ago had been damaged when that iron bar went through his face. So this computer reconstruction was done to do that. And it turned out that was exactly the same area that was damaged in this patient EVR. And if you're interested, this is the book that Antonio Damasio wrote about it, called Descartes' Error, about this patient and how understanding the correspondence between this patient and Phineas Gage helps us to understand the importance of the front of the brain and the importance of emotion for helping us make decisions. I'm happy to answer more questions about this later on, but the important thing about this was that it was the beginnings of our understanding. The front of the brain is really important for controlling our behavior and our decision making. Now, what addiction is about is that it's about pleasure. We all have pleasurable activities that we enjoy, whether it's drinking, going running, parachuting, etc. Now, what has been worked out is where pleasure emanates from in the brain. And the way that scientists worked this out was by using stimulation of certain parts of a rat's brain to see whether they could make the rat do something that would result in pleasure, which was being given a bit of food. And if they stimulated a certain part of the brain, this rat who had learned that they needed to press a lever to get a food pellet started pressing the lever continuously. It wanted more and more and more and more. Now, what that demonstrated was that we'd hit, or the scientists had hit, the pleasure center of the brain. And when you stimulate that, you want more of that same activity. So from work like that, we worked out where this pleasure center was. And that pleasure center is in the middle part of the brain, in that area where emotion and pleasure comes from. And that part of the brain is called the ventral tegmental area. and it gets stimulated by all the pleasurable activities of life, such as drink, sex, food, etc. And we know from the electrostimulation of the rat's brain that the rat also really liked it when this was stimulated, so it wanted more of whatever activity it was engaged in, which in that case was getting food. But we also know, which is relevant to our talk today, that the addictive drugs such as the opiates, cocaine, cannabis, nicotine, etc., all of these drugs also stimulate this area. So the important thing is that there's a biological area in our brain that we know responds to the natural things that we tend to do, drinking, food, sex, etc. But we also know that these stimulants that have been created, these drugs, they tend to work on that same area, which is exactly why they become pleasurable. Now, the important thing for our story today is that that area, the VTA, is linked to another area called the nucleus accumbens. And importantly, that area is linked to the prefrontal cortex, the area that was damaged in both Phineas Gage with the iron bar and with EVR, the patient who had the tumor. So what we've got is two different areas of the brain, the central area, which is the pleasurable area, and that is linked to the frontal part of the brain, which we know from patients like Phineas Gage and EVR is the control mechanism. And in the healthy system, what we have is that this control works really well, which allows us to be able to enjoy things, drink, food, sex, a glass of wine, etc. But the control mechanism in the front of the brain also allows us to step back when we've had enough. So, for example, I was out yesterday evening after my dance class and I went to the pub and I was having a nice time at the pub, but I also knew that I had a talk to give today. So I didn't go out for more drinks. I didn't go out clubbing and I didn't stay out all night because the prefrontal cortex was saying, I know you're having a nice time with that lovely beer or whatever, but tomorrow you've got to give a talk. So you need to be compos mentis and therefore say no to more drinks and go home and have a rest. So in a finely balanced system, you do have the pleasurable activities, but the front of the brain tells you when to stop. What we found out is that in addiction, that circuitry has become maladaptive. And what's happened is that the control section is no longer working. So all we have is the pleasure, wanting more, wanting more, wanting more, just like the rat in the cage, without the control mechanism at the front of the brain saying you need to stop. And that is what we think addiction is about. It's about the loss of the control over the pleasurable activity. Now, looking at how this impacts substance use disorder, SUD, we know that everyone may have some sort of substance use before. You'd have to be a hermit not to enjoy some of these things. And what's been found is that up to 60% of those people requiring inpatient rehab for brain injury may have had prior problems with alcohol and other drug use. Being intoxicated puts a person at greater risk for brain injury because their motor control might go there. They might have blurred vision or they may have poor decision making. So being intoxicated may predispose someone to actually getting brain damage. Also, people who are intoxicated are at a greater risk of being victimized. So actually the use of substances, alcohol, etc., may actually play part, not for everyone, but part of the thing that results in brain damage in some people. So we've got to accept that there's pre-existing use of substances. But I think more important for Headway and for this talk is what happens post-TBI. Now, the problem is that it's difficult to get reliable prevalence data in terms of what levels of addiction to substances occur after brain injury. And there's some controversy on this, partly because of trying to compare how the person was before and after brain injury. So some of the numbers are speculative, but they're ones that researchers have found. So there are suggestions that 10 to 20% of people develop a substance use disorder for the first time as a result of TBI. So these are people who didn't drink a lot before, etc. And following brain damage, they end up with the substance use disorder. Approximately 20% patients who were abstainers or light drinkers before their injury have exhibited in one study high volume drinking after the brain injury. So we've got some data that suggests that at least for some people, the brain injury does seem to kick in some level of substance use. Now, an important thing here is to think about the developing brain, because although a lot of you might work with adults, these adults used to be adolescents. Now, we know from brain imaging studies, which have followed children through a number of years, that the brain is continually developing. And I don't expect you to understand this particular image. The main thing from this image is from the top left to the bottom right, the colors are changing from when the child is 5 years old to the age of 20. Now, the important thing from this brain imaging study is that different parts of the brain come to maturity at different points. Now, the back of the brain, which allows us to see, hear, etc., that part of the brain is fully mature by the age of 5 or something like that. But the front of the brain, which is the decision-making area of the brain, which controls our ability to say no, etc., that part of the brain is apparently not fully functional until the mid-20s. So what we've got is that we've got this developing brain, which especially during the adolescent years is not fully mature, and certainly the front of the brain, which is the decision maker, is not able to say no to things. And this is why adolescence is such a danger zone for the development of substance use disorder generally. Now, when you combine the development of the brain with head injury, you've got a problem here. Now, in this graph, it's a stylized graph, so it's not actual data. What we have along the x-axis is the age of someone from age 1 to adulthood. And on the y-axis, we've got development of different functions. Now, I've got 4 different functions on here. So attentional control, cognitive flexibility, etc. What they are doesn't matter. But the important thing is that if this brain gets damaged at the age of 10, parts of these functions, these abilities are not fully mature yet, because the brain is still developing. And a big issue in pediatric brain injury is what happens to that developing brain if it's damaged. Now, there used to be this idea, or there still is this idea of plasticity and what's happening with this brain that's developing, etc. Now, people used to think, oh, because the brain is plastic, it will fully recover. Well, in fact, the current thinking is that that brain never really catches up to the same level as a non-damaged brain. So the result of that is that kids with brain injury tend to end up with all sorts of behavioral problems because their brain is not fully formed when they end up with their brain injury. So looking at substance use disorder following childhood TBI, a really lovely review by Well et al. That I found has shown, looked at a number of studies that have done what are called cohort studies, where they longitudinally track kids over a number of years. And so they're able to see changes in those kids. And in the most famous one, and a study in New Zealand, they found that children who'd experienced some sort of mild TBI before age 5 were 3.6 times more likely to meet the criteria for some sort of alcohol dependence during adolescence compared to kids with no injury. Similarly, in Taiwan, a 10-year longitudinal study indicated that there was more than a 6-fold increase in the rate of alcohol abuse among patients with a history of TBI. Moving over to Canada, the odds ratio for binge drinking in the last year was between 2- and 4-fold higher in kids who'd had a history of TBI when compared to uninjured students. So what we've got is across these three different countries, we've got evidence. The numbers are different, but there are social and contextual factors. But the overwhelming thing is that brain injury seems to increase the likelihood, if it happens in childhood, increase the likelihood of some sort of alcohol dependence during adolescence. Now, it seems that there are many different things going on. There's the brain injury itself, but there are also indirect effects. So the TBI appears to act indirectly by limiting protective factors and increasing risk factors. So these kids are less likely to participate in extracurricular activities, finish school, marry, be employed, and all of those things tend to help us in terms of a fulfilling life where problems don't occur. And they're more likely to engage in risky behavior and experience long-term alienation from family and peer groups, etc. And all of these are risk factors for alcohol misabuse. So what we have is that the child's brain is even more at risk of problems. In terms of treatment, at the moment, there aren't any strong studies out there. But a study that I found, a review by Corrigan et al., looked at some of this. And what they found is that, as an overview, they found that inpatient or residential treatment for people with TBI is seldom available or affordable. So community-based treatment is necessary. Motivational interviewing techniques have been found not to be that useful when used in isolation. So skill-based interventions are more show more promise. Peer support has been shown to benefit participants in a number of different ways in terms of knowledge about what brain injury does, a sense of empowerment, and coping capabilities. And treatment has been shown to be effective when using both individual and group psychotherapy in outpatient community settings. Now, this may differ from what happens in TBI alone or in addiction. So there seems to be something about combining the two. Now, a word of caution, and many of you will probably know this already, is that dropout rates from rehab in addiction are really high. So these are standard data from rehab, not with TBI, but just that about half of people might complete a rehab program, but 53% don't. And there are the differences between different types of substances do exist. So it depends on what type of substance someone is using. Now, twist in the tail is that it's been found that some sorts of brain injury actually reduce addiction. So this study done in the States, in Iowa, looked at patients who used to smoke, who had damage to an area called the basal ganglia, BG, an area, the basal ganglia, and another area called the insula. So that's in the dark red. And then finally, patients who had brain damage outside these areas. So they're called brain damage control, the BDC in green. And what they did is that they looked at these people before their lesion, before their brain damage, and then they followed them up over 1 year, and they looked at their smoking status across that 1 year compared to before the brain injury. And what they found is that patients who had damage in the basal ganglia and the insula seemed to reduce their smoking the most compared to patients who didn't have damage in this area. Now, the reason that this is interesting, not because it's going to help people with brain injury, is that it holds promise for therapy in the future, because if we know that this area might be important in reducing addiction, then it might be useful for using stimulation techniques in those areas to reduce addiction in people with substance use disorder. So although this comes from brain injury, it might actually help people with substance use disorder. And finally, I just wanted to tell you about some work that I've been doing for a number of years, using an assessment of how the front of the brain works. And the front of the brain, the functions or the abilities called executive functions. Now, because of time, I'm not going to go into the details, but it's a role-playing task that happens on a computer. So it looks like playing a computer game. And through this role-playing task, which was set up with Rehab UK, brain injury charity, we looked at 8 different things that we know people with brain injury have difficulty in when they're trying to go back to work. And this is a screenshot from the assessment where people are moving around, picking up objects, putting them down, etc. Now, in a study that we published in 2014, we compared 17 people with acquired brain injury, ABI, with 30 people with healthy controls, HCs. And what we found in our assessment is that our assessment was able to pick up the difficulties that these patients were having, importantly, that other clinical assessments cannot pick up. So my task, for those of you who know the term ecological validity, my task is an ecologically valid task that picks up the difficulties that people with brain injury have that other tasks cannot. Now, recently, a study that I've done in collaboration with people in Poland looks at people with substance use disorder, so not brain injury, now substance use disorder, and also with, again, with my task, what we're finding in a large study with 63 patients with substance use disorder, my task is picking up the difficulties that these people are experiencing. So this may help with therapy, etc. So to summarize, addiction is complex, and at its root, there's a loss of control. TBI can result in forms of addiction, but in a complex way. So it's a very complex picture. And this can be due to loss of control because of damage in the front of the brain. There are also psychosocial and emotional issues that need to be considered. Severity of damage has a big impact, mild, severe, etc. Also, previous history of substance use needs to be taken into consideration. And then there are even more complex issues for those with traumatic brain injury during childhood. Now, research is beginning to look at what is necessary for treating substance use disorder in those with TBI. And then finally, we've got these intriguing new findings on the reduction in substance use disorder following some sort of brain damage, which may be useful for future therapies. So if you want to hear more, I've got a YouTube channel which has got about 30 talks in it like this, and I'd be happy to answer any questions about that. So thank you very much.